Did you know? VA provides top quality healthcare tailored to unique needs of each veteran. Through your honorable service to our nation, you may be eligible for many healthcare services and benefits. Explore these and other benefits and services available through VA Healthcare. How VA benefits works. Eligibility. If you served in the active military, naval, or air service and were separated under any condition other than dishonorable, you may qualify for VA health care benefits. Current and former member of Reserve or National Guard who called it active duty other than for training only by a federal order completed full period for which they were called it or ordered to active duty may also be eligible for VA health care minimum duty requirements. Most veterans who enlisted after September 7, 1980 or entered active duty after October 16, 1981 must serve 24 continuous months or full period for which they were called it to active duty to be eligible. This minimum duty requirement may not apply to veterans who were discharged for disability incurred or aggravated in the line of duty, were discharged for hardship, or received an early out. Since there are many other exceptions to the minimum duty requirement, VA encourage all veterans to apply to determine their enrollment eligibility. Benefits of enrolling. VA offers a variety of healthcare services from basic primary care to nursing home care for eligible veterans. Enrolled veterans are assured that service will be available regardless of where they seek their care or how often, without having to repeat the application process. VA is America's largest integrated healthcare system, serving more than 6 million veterans each year. Reason to enroll. VA healthcare meets the minimum essential coverage requirements under the Affordable Care Act. Medical care rated among the best in the U.S. No open season or waiting period for healthcare coverage. Veterans can apply for VA healthcare enrollment at any time. VA and Medicare benefits, how they work. Enrolling in both VA and Medicare can provide veteran flexibility. Selecting a Medicare Part A coverage comes at no added cost, whereas Part B comes with a monthly premium. Some veterans may choose to delay enrollment in Part B if they already have other, mainly employer coverage. However, if a veteran delays Part B enrollment initially but decides to enroll at a later date, then they would have to pay a penalty. In other words, VA health coverage does not protect against having to pay a penalty for Part B, like it does for Part D. Having VA health does not qualify as other coverage for Part B. Veterans should bring their Medicare cards to the next VA appointment to update their private health insurance information. Medicare Part C, known as Medicare Advantage. Medicare Part C refers to Medicare Advantage plans which are offered by private companies that contract with Medicare. A Medicare Advantage plan provides all of your Part A and Part B services and usually vision, dental, hearing, and Part D pharmacy coverage. You may pay a plan premium each month in addition to your Medicare Part B premium. You must get all your healthcare service from Medicare Advantage plans networks of providers. This does not apply to emergency services. Medicare Part C and VA. Medicare Advantage MA plan doesn't replace your Veteran Affairs VA coverage. It complements it. With a Medicare Advantage plan, you can use healthcare providers and hospitals outside the VA system, which may be closer to home, especially in an emergency. Medicare coverage. Credible coverage. Enrollment in a VA healthcare system is considered credible coverage for Medicare Part D purposes. This means VA prescription drug coverage is at least as good as the Medicare Part D coverage. Since only veterans can enroll in a VA healthcare system, dependents and family members do not receive credible coverage under veteran enrollment. VA does not recommend veterans cancel or decline coverage in Medicare or other health care plans solely because they are enrolled in a VA health care. VA does not normally provide care for veteran dependents and family members. In addition, veterans who elect to cancel their Medicare Part B coverage will not be able to obtain coverage until January of the following year. There is no guarantee in the future years Congress will appropriate sufficient medical care funds for VA to provide care for all the enrollment priority groups. This could leave veterans, especially those enrolled in one of the lower priority groups, with no access to VA healthcare coverage. For this reason, having a secondary source of coverage may be in the veteran's best interest. For more information, to go to www.va.gov/healthcare /about VA health benefits /VA healthcare and other insurance. Applying for Medicare or have VA benefits? Let's talk. Together we can help you find a plan that will meet your needs, or to learn more how VA benefits work with Medicare. For a free consultation, go to www.camaraderiehealthagency.com or call 224-433-5754. Like us on Facebook, connect with us on LinkedIn, and subscribe to our YouTube channel.